My name is Dr. Said Raban. I'm board certified in internal medicine and gastroenterology. I am the owner of Beverly Hills Digestive Diseases Center, in which we deal with problem of gastroenterology conditions. The background of mine is that I am currently assistant clinical professor at UCLA and also teach the medical doctors at Cedars-Sinai Hospital as well. The gastrointestinal system basically covers the areas from the mouth up to the rectum. These areas are throat, esophagus, which is a foot pipe, and also stomach, small intestine, and large bowel. There are two other organs attached to the GI system, which is called liver and pancreas, which they also have their own problems. But basically we deal with a lot of patients which they have problem with the GI system, meaning the esophagus and the stomach and the large bowel, though we also treat patients with liver disease and pancreas. The symptoms of gastrointestinal conditions are basically various, and most of them are problems with pain in the abdomen or chest area. The pain in the abdomen could happen everywhere into the upper part, below the wishbone, or other parts of the abdomen, and sometimes so severe, occurring over the chest area, that the patients have to go to the emergency room because of fear for heart attack. So they could really imitate the symptoms of heart conditions. But the symptoms are usually heartburn and difficulty swallowing, and cough at night times, signifying the problem of heartburn, and also nausea, throwing up. Could be another problem with the stomach pains, with the ulcers again, they could produce their own symptoms. A lot of gas, and also constipation and diarrhea, and rectal bleeding, and sometimes black stools, which signifies bleeding from upper part of the GI tract, which is the stomach and esophagus. Sometimes the bleeding is so rapid that comes from the rectum, again signifying problem which is in the rectal area. The problem in the rectum could be colitis, polyps, tumors, that they could bleed as well. Sometimes you see obstruction in the GI tract. Also problem, upper part of the GI tract would be the cancer of esophagus and the stomach. So there are a variety of conditions. In the liver, you could have problem with fatty liver, alcohol-induced liver disease, and drug-induced liver disease, and also tumors of the liver. And gallbladder with gallstones, which is familiar with everybody. As well as the pancreas goes, there is also inflammation of pancreas, which is called pancreatitis, which is due to many reasons, and one of them would be virus or alcohol or side effect of medications, and cancer itself sometime, or diabetics sometime they have pancreatitis. So it's a wide variety of symptoms in the GI tract, which attracts the attention of the patient, and subsequently they have to go to the doctor as soon as possible. Now, how do we diagnose these conditions? Basically, we put a lot of importance of physical examination in the first visit in the office, in great detail, questioning patients from the symptoms, the way it has started, and also examination physically. And subsequently we get blood work, which gives us some more information about the condition inside, particularly the GI tract, or organs related to the GI tract, such as liver or pancreas. Also, we check the stools to see if there is any occult blood, which is non-visible blood, that the patient has been told that he or she has anemia, but he doesn't, or she doesn't see any blood in the stools. So they have to check it by chemical stuff. And finally, we go toward CAT scan and x-rays, ultrasound of the abdomen. And finally, the best way is to proceed with endoscopy, through which we have a pipe, which is a fiber, and there is a light in it, and we can go from above and the below and look inside the stomach and the colon while the patient is in the kind of superficial sedation and sleep with mild anesthesia. Usually it takes about 5 to 10 minutes for the upper GI tract, and for colon about 20 minutes, which of course preparing for colonoscopy need some laxatives in the day prior to procedure, having a special diet. Now the question is that, is there any relationship with work injury and GI symptoms The reason is that I'm a qualified medical examiner gastroenterologist in the state of California. And I get a lot of referrals from the defense lawyers and insurance companies in regards to the conditions of injured workers who have suffered symptoms in GI tract. And the symptoms are usually severe heartburn, severe pain over the upper part of the abdomen, or rectal bleeding and severe constipation or even diarrhea. Any of those could be secondary to the incident that the applicant or the injured worker has been dealing with in terms of traumas and side effects of medication mostly, such as non-steroidal anti-inflammatory agents such as naproxen or Advil or anything like that, which cause a lot of problems in GI tract, including ulcerations and colitis, even abnormal liver problems, which is quite common in some occasions. Also, they could have bleeding from hemorrhoids, which has to be diagnosed and treated. Again, related to lack of physical activity and side effects of strong narcotics that you usually receive due to their work injury. All of those conditions are referred to me, and I will evaluate them, and I send the reports to their representatives in terms of lawyers and insurance companies as well. So altogether, GI tract is a structure of very complicated structure, and there are lots of symptoms that most of the people have, but they might not pay attention to, but it's worth it to go after it before it gives you the bad damages.